I'm Esme Fuller-Thompson from the Factor in Wintosh Faculty of Social Work, and I'm Director of the Institute for Life Course and Aging. We are so lucky today to have Professor Sylvia Langlois with us. Sylvia is an Associate Professor in the Department of Occupational Science and Occupational Therapy, as well as the Faculty Lead for the Interprofessional Education Curriculum and Scholarship for the Center for Interprofessional Education here at the University of Toronto. Thank you so much for joining us today.
Thank you so much for the invitation, Esme. I'm delighted to have this time with you.
Could you tell us what interprofessional teams are?
Language has been used interchangeably, but is nuanced. So for example, you'll see even in the literature, we'll see reference to multidisciplinary teams or multi-professional teams and interprofessional teams. And we'd argue that there really is a fairly significant difference there. So if we look at a multi-professional team, in some sense, I would describe it as parallel play. So it's the equivalent of you as me working as a social worker, I working as an OT, someone else working as a nurse, be it in a hospital or in the community. We're each doing our own thing, doing it well, but each doing our own thing. But we don't take the time to think about what is important to the individual and across the professions and how we work together. So if you think about an interprofessional team, you and I, as me, might have some areas of overlap in terms of how we would look at an individual or be concerned about an individual. And I can think of an example of being discharged as somebody who's in a hospital setting is being discharged back into the community. And if you and I were to go in and assess that individual together and to talk about what the needs of that individual was, then between the two of us, as well as with others on the team, we could determine what's most important for the individual, and of course, including them. I talk a lot about patient-partnered teams where we're engaging with the patient and or family, depending on where the individual is at, and thinking about what's important and how do we work together to arrive at those goals. So determining what those goals are together across the team and with the individual, and it becomes very much an integrated approach as opposed to the parallel play approach. And that approach is seen to be optimal. We're seeing that in the literature, a number of different studies that have shown that as teams work together, the functional decline of individuals is slowed down significantly. Individuals have shorter hospitalization, patients have shorter hospitalization, they have shorter stays and fewer hospital or outpatient visits. When that is properly coordinated, all aspects of the individual are considered and addressed much more holistically than what it ever can be in the parallel play environment. So it's in working together that we create the best possible opportunities for the individuals with whom we're working.
What strategies promote effective interprofessional teams?
I'm thinking of the examples that we have in the Toronto area hospitals where interprofessional teams and collaborative practice are very much integrated into the strategic plans and into the operation of the hospitals themselves. So that system approach that values those teams and integrates those teams filters down to the team and the expectation as well. The other side of it is teams that value that time together and being able and understand how important it is for them to work together. And then the strategies at the patient provider, the clinical provider are important as well. So for example, it could be managers that determine that this level of communication is important. And so it may be that there are shared assessments. So as I mentioned earlier, you and I may go in and assess an individual together. We may even ask the same questions, but just by the fact that we have different professional lenses, we're looking for something different, and we're listening for something different. And when we come out of that, we're going to be able to package something differently or have a different understanding of that individual. The shared management plans, talking with the other healthcare providers, everybody who's involved, finding the opportunity to have those shared management plans makes a really significant difference for the outcome of the individual. So those are really two really important pieces. We think about communication there in terms of the language that we use, the competency frameworks that we use. We think about communication, so setting up the systems that allow us to be able to communicate. The collaborating that I just mentioned, being willing to collaborate. And that gets into some turf wars sometimes. And it depends on what the facility, the organizational environment and culture is in terms of how those turf wars can be negotiated. And because there are overlapping scopes of practice, it doesn't make sense for you and I to argue about who does what and for me to maintain my turf, when in fact what we should be looking at is what is most important for the patient, the client, who is best able to do it. And there's more than enough work to go around. And so we really don't need to guard our turf. We recognize that we each have areas of expertise and we don't need to guard the turf. So that ties into role clarity. It's the clarity of the role in that particular setting. I would need to understand for you as a social worker, the scope of practice that you have, and also specifically the role that you have with the individuals with whom you're working. And likewise, you would need to have that understanding of what I might do. And there may be areas where we negotiate and say, you know what, why don't you look after this part? I'll look after this part. I think ultimately, and we talk about it as one of the core competencies, if we truly value the patient, the partnership with the patient or the client and the family, then hopefully we can set aside where some of those challenges may sit and be able to work together. I'm thinking of an example of my mother who became very ill in ICU, a few things that happened in between. In ICU, came from ICU and into a ward bed after 5 days in ICU. And because of the demand during the influenza, the height of the influenza season, she was put into a ward bed, and within a very short time period was discharged or encouraged to be discharged. And I came onto the ward at a time when I overheard a conversation happening at the nurses' station. I didn't know who was having the discussion, but there were enough pieces there that I thought, you're talking about my mother. And so I said, you know, I'd like to be involved in this conversation, if you don't mind. And so they came into the hallway, and it was one of the attending who had said, you know, so what are your concerns? So I expressed my concerns, and she said to me, you know, this would be much better if we had this conversation with your mother as well. And within 10-15 minutes, she was able to gather the physiotherapist, the nurse, the social worker, the discharge planner, herself, the OT, and they all gathered around the bed with my mom there and with me there, and we talked about what the issues were and the areas of concern were. It was a beautiful example of the team working together, problem solving together, trusting each other, and at the same time fully engaging me as the daughter and me facilitating that for my mom. And we had a wonderful outcome, very, very supported outcome. And we had great community supports that were set up to enable her to go back home again. So that was the team functioning at its best in terms of being able to trust each other, to pull each other together, to collaborate, to do decision-making together, to have shared and common goals, and resulted in a good outcome as a result of that degree of and the strategies that they had employed for that interprofessional communication and collaboration.
What strategies would you recommend to address tension in interprofessional teams?
Professional identities play a huge role in conflict. And that's why we talk about and teach very specifically interprofessional conflict. Years ago, I read a study that made reference to the fact that our professional identity is stronger than many of our other identities. And we've spent years becoming a social worker, years becoming an OT, and it becomes a very, very strong identity. So put that into the context of a conflict. It's not just you and I disagree about something, but I come into it not just as an individual, I come into it now as an OT, and you're holding your ground as a social worker. So I think the key thing is always recognizing that those conflicts will happen, period. That's normal. It's thinking about the complexity of the conflict and recognizing that you're not in the midst of that conflict solely as you, as me, as the individual. You are, as me, the social worker. So you're bringing you, the individual, under the umbrella of you, the social worker, which is deeply ingrained in you. And then your role of what you need to do. So if you're working with decreased resources, you need to bring that into it as well. And that tension point can happen. So if you can come to an understanding of what the common facts are, and you would know all of this from social work, right? It's what the common facts are, what you can agree to, looking at what's most important for the patient, for the client, for the family, and having a relatively emotion-free conversation and trying to come to that point of agreement. I often look at these scenarios and say, this is an opportunity for me to grow in my conflict competency. It's an opportunity to make sure that I'm putting myself as much as possible into the shoes of the other person so that I can understand what that position is, and recognizing that it is an interprofessional tension because we see things differently. And so I have to understand to the best of my ability how you see things and how somebody else sees things, and understand it and try and find those areas of commonality, recognizing that what's most important is to optimize the approach with the patient or client.
Is there anything else you'd like to share?
Having a desire and a willingness to collaborate is most important. And there's some humility that comes with that, and some power sharing. I think for the professions that have struggled a little bit more to gain their foothold, that may appear a little bit more within the system. And so if we recognize what our own position is, and if we can come into a position with humility and with curiosity, knowing that we're advocates, knowing we're there to learn, that will support how the team can work together. And a clear desire for that degree of collaboration, and a clear desire to know that the patient or the family unit are what's most important.
Thank you so much for presenting today. It was really very interesting, and I want to thank you for taking the time.